Hi everyone! I hope you're all doing well and are safe. Welcome back to the next episode of Cancer Behind the Scenes as presented by Cancer Together. In today's video, we'll be learning about radiation therapy in depth. Here's just a short reminder. Make sure to check the official Cancer Together website for any updated information on this series, to watch the YouTube video when it drops, and to play the educational game, which in this case is a Kahoot, to help retain the information in a fun, interactive way. Before we get into any new content, let's just revisit the previous video and recap briefly. Last time, as we mentioned, we'll be talking about each form of treatment in their own exclusive videos. In particular, we talked about the different types of surgery and how they're used for treatment in our last video. And now, we'll be moving on to our next treatment of discussion, radiation therapy. So first off, let's talk about radiation in general. At different doses, radiation can be used differently. For instance, at low doses, it's used in X-rays to see your body, while at high doses, it can be used as cancer treatment. For cancer treatment, how radiation therapy, aka radiotherapy, works is by damaging the DNA of cancer cells for days and weeks of treatment to damage it enough so that the cancer cell's growth slows and so that these cells are more likely to die even after treatment ends and be removed by the body later. From our previous videos, we know that radiation therapy will hurt healthy cells through this method, but the damage won't be permanent since they'll be able to heal and recover from the therapy. Aside from treating cancer, radiotherapy can also be used as a palliative treatment to ease symptoms caused by cancer. For this type of treatment, the timing it's given depends again on what the type of cancer is and whether the goal is to cure cancer or ease the symptoms it causes. The types of radiotherapy mainly branch into external and internal radiation. Which type you get depends on a number of factors like what type of cancer you have, the size and location of the tumor, how close the tumor is to normal radiation-sensitive tissue, your general medical history, if you have any other medical conditions, and if you'll have other types of treatment that you'll be undergoing or are currently undergoing. Continuing off of that, let's talk more specific to the different types of radiotherapy. External radiation beams are going to come from a machine aiming radiation at the cancer at a specific part of the body, making it a local treatment. External radiation is used to treat many types of cancer and may shrink tumors to alleviate problems caused by cancer. Internal radiation beams are evidently going to have the radiation source inside the body, and it can be further subdivided into two more categories based on whether the radiation source is solid or liquid. When the radiation source is solid, that's what would be called brachytherapy. It's another form of local treatment, and how it works is that either seeds, ribbons, or capsules containing radiation are going to be put inside the body or near the tumor and give off radiation for a while. When this radiation source is liquid, it's referred to as a systemic therapy. For this one, how it works is that the liquid radiation source is swallowed through an IV line or through an injection, and then it's going to travel through the blood to tissues throughout the body, and it's going to cause bodily fluids like sweat and saliva to give off radiation for a while. Depending on what the radiation source specifically is for systemic therapy, it can serve different purposes. Like radioactive iodine can be used to treat thyroxine cancer, radionuclide therapy for advanced prostate cancer, and radiopharmaceuticals to treat the pain from cancer spreading to the bone. As we come close to the end of this video, there are just some other points to highlight for radiation therapy. First off, one note repeated consistently is that it can be the only treatment needed for some while used in coordination with others. For instance, it could be used before surgery to shrink the cancer size to be removed more easily and make it less likely to return. It could be used directly on tumors during operations without cutting through the skin as intraoperative radiation, and it could be used after surgery to kill remaining cancer cells. Furthermore, it's important to note that there's a limit to just how much radiation one can safely receive without causing too much damage to nearby healthy cells. which is why radiotherapy can result with side effects due to so much energy being used by the body to heal during therapy. Because of this, you may not even be able to receive therapy to an area a second time unless it's in another location far away enough to be treated. And I believe that's a good place to stop. Thank you for joining us today for this video, and I hope it was informational and interesting for you all. Remember to play our educational game to review the information in an interactive way, and to keep an eye out for when the next video drops. Thank you all again, and have an amazing day.